Hey everyone, welcome back to my YouTube channel, Alfred Atanda MD. I'm Alfred Atanda and I'm a pediatric orthopedic surgeon that specializes in sports medicine. As you can see, I'm on call at the hospital working. I have my little mask here and I hope everyone out there is staying safe and staying healthy, isolating and self-quarantining in these tough times that we have. But despite the pandemic and despite everything that's going on, one of the things that we see a lot in orthopedic surgery is that a lot of injuries, specifically sports injuries, still happen. Maybe not from organized sports, but kids are playing in the backyard, they're jumping on trampolines, they're roughhousing in the house. And we see kids every day that are still breaking bones, that still need surgery. And, in and of itself, having a child or even yourself that get hurt can be very distressing. But during these times, it can be very confusing as to, well, what do you do? Because normally you would get up and go to the ER or go to the urgent care. But now, in these times when everybody's trying to stay safe and minimize exposures, there's a lot of confusion as to what kind of injuries could be managed even just at home. Now that we have telemedicine and virtual health and virtual doctor's visits all over the place, can we manage some of these injuries at home and while we're still staying safe and staying out of emergency rooms and other clinical facilities? So I just wanted to review a couple of things that you can think about if and when, knock on wood, you or your child sustains an injury, whether you fall down the stairs or you're playing a sport in the backyard. The big thing to think about initially is is it an acute versus a traumatic injury? Acute versus a chronic traumatic injury. So is it something that you were running and you twisted your knee or you rolled your ankle, one discrete motion that hurt? Or is it something that's been kind of nagging you even before coronavirus, but now it's getting a little bit more uncomfortable? Those acute injuries that you can pinpoint one thing that happened, those are the things that tend to be better treated in person or in the emergency room. If it's something where you see a lot of swelling or a lot of bruising, or you're having difficulty walking or bending the joint, those are also going to be things that you may want to seek medical attention for. Things where your skin looks good, you don't notice a lot of swelling or redness or bruising, you're still able to bend your joint, you're still able to put weight on it and walk around. Those are things that you may want to chat with somebody virtually via telemedicine and get a sense of what they think before you go ahead and expose yourself. Couple other points. So if it's something that's bothering both joints, so if you have knee pain in both of your knees or shoulder pain in both of your shoulders, typically things that involve both joints aren't going to be too severe, so you may be able to chat with somebody via telemedicine initially to get evaluated for that. If it's one particular joint in one pinpoint area in the joint that's causing a lot of problems, that could be something a little bit more worrisome. But again, vague kind of global pain in a joint may be something that you can look after just at home with a virtual doctor. Other things to think about if the joint pain or the leg pain is associated with a fever or feeling fatigued or ill or having chills or a lot of warmth. Those are definite things that you probably want to head into the emergency room or at least the urgent care to get evaluated for and not manage at home. So, I hope these tips were somewhat helpful. Again, just use your common sense. Always err on the side of caution. I'm not your physician, obviously, but if you have a physician or a PCP or somebody that you know of and you want to bounce an idea off of them, that would probably be the best. But a lot of these issues, whether they be minor or acute or severe issues, can potentially be treated via telemedicine. You just want to make sure that it's not a serious thing. And some of those things to think about will help guide that. Obviously, there'll be a lot of confusion and anxiety when you're thinking about what to do. But hopefully, this video shed some light on the situation. We hope all of you stay safe and stay healthy. Hopefully none of you do get hurt, but if in fact that you do find yourself hurt and you're not exactly sure what to do, you can refer to this video and maybe it'll give you a little bit of guidance. But thanks again. Stay tuned for our next video, and please stay happy and healthy.